Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ER nurse. Today, we are going over key points you should be aware of when taking your patients to CT. You're going to be taking patients to CT often, so it is very important to keep these points in mind. Again, thank you for watching. The first key point is that any female patient of childbearing age needs a negative pregnancy test because the radiation from the scan can be harmful. Typically, it's obtained with the POC pregnancy test with urine. Some facilities do allow you to use blood on the POC preg test instead of urine, but you have to for sure verify this with your own facility for their policies and protocol. So just make sure that they do allow you in their policy to do this if you are going to be doing this. If not, a urine sample or a blood sample that gets sent down to the lab is also adequate. Next, if you're giving contrast, you need to ensure that you get kidney function labs, especially on patients with a medical history that may affect the kidneys, like diabetes and high blood pressure. If you give contrast to a patient that has bad kidneys already without checking, there's a possibility of causing an acute kidney injury. If the labs are a little out of whack, sometimes hydrating the patient may be enough. But like always, it's better to be safe and check the values beforehand, which include your creatinine, your BUN, and your GFR. Next, which is one of the most important, is to check for allergies to the contrast/iodine. If a patient has a history of going into full-blown anaphylaxis, the patient is not going to be getting any contrast at all. On the other hand, if the patient if they only get a mild rash, the provider may still choose to pre-medicate the patient and still do the exam. Of course, always check for allergies and ensure that the provider is aware, but never take a patient to get a contrast if they are known to go into anaphylaxis. CYA, don't do something that is unsafe. Next is IV size and location. Ideally, if you ask the CT techs, they'll ask for an 18 gauge in the AC, but from my experience, I've found that for many exams, a good 20 gauge middle forearm or up still works great. Of course, there are certain tests, like if they are looking for a pulmonary embolism, where you should ideally try to get an 18 gauge in the AC. But as I said, a 20 gauge in the upper forearm should still work. Sometimes patients just don't have good access, right? But of course, verify with your own facility for what is acceptable so that you know what you should be aiming for when you are going to place the IV catheter. Next, let's educate our patients on what they may feel when the contrast is getting injected. They may feel warm, and some patients may feel like they're urinating on themselves. It's important to educate your patients beforehand so they are not surprised by the effects. Know that it is important to remove metal objects that may get in the way of the exam. For example, if you're doing a chest CT and the patient has necklaces on, you need to remove the necklaces beforehand. Same goes for head CTs, right? If the patient is wearing earrings or hair clips that have metal in it, those need to be removed beforehand. Now, if your patient is on metformin, it is key to hold the metformin because there is a chance of developing metformin-associated lactic acidosis. Typically, it's held the day of and 48 hours after. So if they won't be taking it, ensure they are keeping a close eye on their blood sugar, monitoring for any increases. And finally, ask your patient if they are claustrophobic, although they won't be in a tight space because most scanners have this donut shape. You should ensure your patient is comfortable. For most patients, I've found that if you educate them beforehand, they will do better, and they won't have to get any medications to help them relax, especially if you educate them beforehand and help them relax with verbal reassurance. Some additional tips I want to mention is that while you are new, I believe you should take every patient on a monitor who is sick to get you into a good habit of monitoring your patients when leaving the department, when leaving their room. Once you have years of experience, you'll be able to decide who needs a monitor and who doesn't. But in the beginning, you better be taking every patient that's sick on a monitor. Alongside this tip is that for any of your critical patients, you should take emergency medications. Most facilities have a transport meds box just in case something happens while you are out of the department in CT. So I recommend that you take this meds box that has all the critical care medications in case of something happening. Just in case something does happen, you have it there and you're ready. Next, you should know what's where in the CT suite. Know where the crash cart is, know where the oxygen equipment is, know where the suction is, know where all the important things are at. Knowing where things are at is essential because I guarantee that someday one of your patients will crash on you in CT, and it's critical for you to know where the supplies are at in CT. Thank you for your time today. I hope that I was at least able to teach you one thing. If you want to keep learning, I've listed my favorite ER nursing related books in the description, with my favorite being Sheehy's and the Case Files. As well, please take the time to watch my other videos. Also, if you would like to help support the channel, I have nursing stickers and shirts on Redbubble that you can check out again. Thank you for your time today. And as always, teamwork makes the dream work. And here at Emergency Chaos, we are proactive, not reactive.